Aloha, everyone. I'm Eva Andrade, and on this episode of Faith in Politics, we're going to talk about the lockdown and its effect on Hawaii students, and we're going to continue our discussion on the rating of the leaders of the government of Hawaii during the lockdown. So let's chat about that. When you get over one problem and you find yourself in a much bigger problem, what happens? Do we give up or do we become stronger because of the problem? You know, I mentioned before that my mom has these sayings that she uses all the time. And my thought this week is about one that she used to use. And she used to warn me about jumping from the frying pan into the fire. The first recorded use of a similar analogy was in a poem by Germanicus Caesar way back when in the old days in the Greek anthology. And there it applied to a hare in flight from a dog that attempts to run away by jumping into the sea only to be seized by a sea dog. Then the earliest recording use of the English idiom was by Thomas More in the course of a pamphlet war he had with William Tyndale, and many of you will recognize that name as someone who translated the first English Bible. So in this pamphlet, More asserted that his adversary, quote, "fairly conveyed himself out of the frying pan fair into the fire." And I apologize, I'm not so clear on the Old English. Most are aware of the major conflict that More had at the time because the King of England was trying to usurp the church's role. 2 Peter 2:20 states, "For if after they have escaped the defilements of the world by the knowledge of Jesus Christ, they are again entangled in them and are overcome, the last state has become worse than the first." So I was thinking about the question that many have asked me recently. Is the vaccination worse than the virus? The pause on the Johnson & Johnson vaccination, it deepens the worry of people and it makes more unanswered questions than it should. The misinformation and conflict of information is creating a swell of mistrust. Leaders around the globe are trying to juggle this issue of vaccination passports, states red and blue, and they're handling it very, very different. And rather than seeking a common ground, they're just finger pointing and partisan politics, folly, just creating havoc all over and making more and more mistrust. And of course, there are those who believe that there is evil afoot and the mistrust gets worse and worse. Another question posed to me recently is, would Jesus take the vaccine? And that question I cannot answer because Jesus always considered the greater good. And of course, there's the scripture that you render unto Caesar what is Caesar's and unto God what is God's. But that was about taxes. So I'm not going to answer that question. I will leave that to the theologians. But when it comes to leadership, mistakes can be made. And imperfect people, as we all are, will be imperfect leaders. Most people will give grace and forgiveness when the heart of the leader is in the right place. We can't control other people's hearts, but we sure can pay attention to what's happening in our own. The frying pan may be uncomfortable, but most people are wary of leaping out of it too quickly, lest they get burned. And maybe we should learn something from Shadrach, Meshach, and Abednego, who walked around in the fire and didn't get burned. However, the secret to that is that they walked with Jesus. And that's my thoughts for this week. Welcome back to the show, everybody. And we really look forward to having a great discussion today. We have a special guest for you. We have Dr. Hale Akamini, who is going to be sharing his mana'o with us as we delve into this first quarter, where we're going to be talking about the state of the lockdown and its effect on the students in Hawaii. And we're not even going to just be talking about that effect of the students here in Hawaii, but some of the studies that have been done nationally. And I'd like to introduce and welcome to the show today, Dr. Hale Akamini.
Hi, good to be here, Eva.
Oh, hi, Doctor.
Yeah.
Good to be here.
And I forgot, we always, as always, have to welcome Jim Hockberg to the show. Welcome, Jim, as always.
Don't forget.
I know. I'm sorry for that. For a moment, just went out of my head.
It's okay.
Okay. You're important. But so Dr. Akamini, one of the things that we've been talking about over the past several weeks is just the detriment that the past year has had on society as a whole. We've talked about how families have been affected. We've talked about how government, and later on in the show, Jim and I are actually going to talk about how some of the faith-based community have rated the leaders over this lockdown. But I think a lot of people are very concerned about the youth and the closing down of schools and how it affects their mental health. So we'd like to get your thoughts on that.
Well, I've also expressed a deep concern. As a clinical psychologist for about 30 years now in Hawaii, and this has been unprecedented in terms of the scope of the damage, I believe, that the lockdown has caused among the students. And I see about a handful of students right now. I'd say about 6 to 7 on a regular basis. And every single one of them have been affected. No, I think about it, maybe 10, very negatively by the lockdown. If you look at, and the population that I see in terms of the youth are the high school aged kids, right, from 13 to 18. And developmentally, what the task that they have to go through in order to be a competent, healthy adult is to be able to learn how to interact appropriately with each other. Number one. Number two, to be able to access support outside of just their peer group, adults and people who are in the community, obviously in the schools, the teachers, in order to grow themselves emotionally and definitely relationally. So the damage, I feel, has been enormous.
Do you think that there's also a correlation between, there are some studies that are showing that even parents, because they had to stay home with their kids, right? And they had to help kind of homeschool their kids in a sense, that the stress of the parents might also be an effect in what these kids are dealing with?
Well, the parents are thrust in a role now to sort of be educators. And for many of them, that's not a role that they've ever had to play except for their toddlers, maybe. But now to be able to guide and to stay on top of their kids who are just working through adolescence themselves, and to make sure they're on top of their homework, to make sure they understand it. And it's something that for most of them who are, whose kids are in the public or private schools, they're just pulling their hair out, trying to figure out how to support their child when they themselves don't know what to do with, let alone juggling their schedules and the stress of their unhappy teenager, which of course can create a bit of more problem than when the kids were a little younger.
Well, I can tell you from my own experience, I have a senior in high school that's in my house, and we had to share the same workspace. And people that know me know that I was ready to commit suicide myself. I realized that you're a psychologist sitting across from me, and I'm half joking when I said that. Sure. Half joking when I said that, because there were days where he'd be doing his work and I'd be hearing the teacher and how they're interacting. And I'd be thinking to myself, oh my gosh, is this really what kids are learning in school? So I was thrust not only into having to help him with his homework, but learning for the first time what he's actually learning in school. And so there was some positive to it, but a lot of negative.
Yeah, I mean, of course, it's both sides. As you said, you get an understanding maybe to some degree of what your child or children are experiencing in school somewhat, but it's a brave new world. The teachers themselves have no training in how to communicate using the internet, let alone all the attending problems of fallout in terms of signal, of how do you get the students' attention when they just basically mute you out or turn off the screen.
Exactly.
But I've got friends who are going through that same thing with their kids. And what you said is a bigger problem. They're hearing what it is that's being taught to their kids, which when the kid is in class, if they don't tell you, you have no way of knowing, basically. And some of my friends who are very strong Christians, but whose kids are in the public school, are very upset with some of the lesson material.
Well, yeah, and I want to get more into the mental health of the students, but on that point, I know that there was a rise in people who decided that they're going to start homeschooling their kids because they did become in that awareness. But one of the things that I want to get your expertise on is that Kaiser High School actually did a survey on their students, and the students answered how they're feeling on these things. I'd love to get your thoughts on the results of that survey.
One of the most sort of funniest thing I saw in terms of their reaction was that the students wanted less assignments and homework in general and leniency with due dates. Well, I think that all students, we've been there, right? We want less assignments. But the other thing is in terms of, and it reflected what some of the national surveys have found and concerns about kids is that they need that personal interaction time. They need to be able to interact interpersonally, that you just can't have that same depth and quality interacting over Zoom or whatever the social platform is. And they're suffering because of that. And it's a need that once you pass that, you can't recoup time. And how do you gain back that kind of development of your skills, issues of self-efficacy, of issues of, am I communicating appropriately, where you would get that natural, normal ebb and flow about how to check yourself socially. So there's just some serious concerns about what is happening, is reflected in the survey, that definitely what they want is to be back in school.
And this was a survey that Kaiser High School did for their high school students, right? And do you have that paper in front of you? How many students responded to this survey?
About 20% of the students, I believe. So it's 1,173 here. It's 200 of the student. That's a student body there at high school, and 229. 20% of the student body responded to it.
Do you feel, as a psychologist that's worked in Hawaii for all of these years, do you feel that this would be across the board? Do you feel that this would be how high school students across the board, whether they're in private or public high schools, would feel the same way? Do you think it's a good survey?
Yeah, actually, it's reflective of the national surveys and surveys of students both in Hawaii and of course across our nation, in terms of what their needs are and what needs are not getting fulfilled. And of course, clearly the social needs has been exacerbated in terms of its inability to be fulfilled and thus grow the child in a healthy, emotionally, psychologically, relationally area. So.
I know. And Jim, I know we were talking before the show, and I know you have some burning questions too that you'd like to bring up.
Well, it's not really a burning question, but
it's always burning with you.
The first several questions on the questionnaire were, I don't know, they were so vague. Like the first one is, how would you rate your mental health? So if you ask a high school kid to rate their mental health, which I don't do for a living, but you probably do,
right?
What does that question actually mean?
So how are you feeling right now? Right.
So why didn't they say, how are you feeling? You know what I mean? It's like if they said, are you, like some of the later questions were more specific. Are you depressed? Do you miss being with your friends or something? But how do you rate your mental health? What the thought that occurred to me is the generation that's being asked these questions have kind of been trained that they're victims anyway.
All right. So unfortunately, we're running out of time, but Dr. Akamine, if people wanted to reach you, how could they reach you or get more information about what you do?
Well, they can go to the website. It's counselinghawaii.org. And it's we're the Family Ministry Center. We're a faith-based nonprofit, really a Christian counseling, professional counseling center.
So stay tuned, everybody. We are not running away. We're just taking a break. We'll be right back. Mahalo.
It's no secret that Kala TV is the only local Christian TV station reaching the islands of Hawaii with 24/7 Christ-centered content. Just how important is Kala TV to our culture?
Think about it. This year has been unprecedented. The pandemic lockdown, churches closed, religious freedom, a nation divided, cultural unrest. If there's ever a time that we need Christ-centered content, it is now.
Our community is struggling. Depression, suicide, unemployment, lack of purpose. Many of us are without hope. In fact, some of us are considered non-essential.
Non-essential? That's absurd. In fact, there's never been a more crucial time that the church is essential. We have the hope of Christ, the answer for our time.
And Kalo TV is committed to broadcasting the good news across Hawaii.
And that's why we're reaching out even more to those in need of God's love. Here's how.
We're starting a new initiative called Kalo Outreach, where we're going into our local communities and becoming the hands and feet of Christ.
We continue to create new and original programs that will reach every generation with the hope of Jesus.
We are adding new local and international programs to Kalo TV. After all, it is our intention to be a bright light to Hawaii and beyond.
Look, it hasn't been easy for any of us. In fact, if you need prayer, we are here for you.
And if you need encouragement, please tune in, whether it's on air, online, or on social platforms. Our vision is to provide uplifting content.
Would you join us as we broadcast the good news? This is our opportunity to come together as a community.
Right now is a pivotal time to invest in Hawaii. First and foremost, let's pray together for Hawaii. And for those who are able to, here are some ways that you can give.
As we are that the sun will set tonight and rise again tomorrow morning, so is our hope in Christ.
Kalo TV, the Aloha station, broadcasting Aloha 24/7.
Hi, welcome back to Faith in Politics, and this is the segment that I get to share things I've been thinking about. So, you ever see those movies where the Germans go up to people on the street and say, "May I see your papers?"
I know nothing.
Okay.
Nothing.
Well, so the question is, are we going to have COVID passports where the people around, the government, the police, the restaurant owner can say, "I want to see your papers before you can do
Wait,
this"?
is that a Cheech and Chong thing too?
No,
Your papers?
It's not.
It
no.
is.
And the thing is, in the last 2 weeks, there's been a lot of really conflicting information about these passports. Some people say the federal Biden, at end of March, says the federal government has to be leading in this passport for vaccination proof thing. And then people come out in the federal government in Fauci says, no, the federal government's not going to do passports. And then congressmen introduce bills saying it's illegal to have passports for vaccines. And then the states say, we're going to have it. Josh Green wants to have it, but Ige says we're not going to have it. Meanwhile, in the background, the airlines and the restaurants are wanting the government to give them this protection of vaccine passports. But so what I want to talk about is that likely? Is it probably going to happen? Is it probably not going to happen? And in order to do that, we have to go back to the beginning last year. Why do we have the vaccines? And what are the vaccines? And are they appropriate to be mandatory for this passport thing? And so as we've talked about before, when the federal government wants to do something new in the executive branch, it needs to publish new rules and requirements in what's called the Federal Register. And we've got a couple of pages of the Federal Register from last March, I believe, that addressed this COVID thing and the vaccines. And what the CDC did under the Food and Drug Administration back then was say, we're going to allow vaccines to be done under Emergency Use Authority, EUAs. That's really critically important because it's still what it is. And what that means is none of the vaccines are actually fully authorized. They're being used under the emergency use authorization, which requires, this is kind of interesting, because there's nothing else currently available to help solve some problem, which is this disease. So when something is an emergency use authorization, it is always optional. And the FDA says the people presenting this vaccine have to tell the people receiving the vaccine that it's optional. And that's important because how can you mandate something that's optional because it's not fully approved? Now, the other interesting thing is what emergency use authorization means is it's still being tested and experimented. So we're actually in the middle of a vaccine experiment that optionally is available for everybody to participate in as a recipient of the vaccine, which means they're still trying to figure out whether they can apply for full vaccine like the flu and rubella and measles. Those are all finished experiments. The COVID vaccines, all of them, are still in experimental stages. And here's the interesting thing. Medical experiments always have to have a control group against which you measure the effects of the group that took the medicine. So if you're not yet receiving the vaccine, you're still in the experiment because you're part of the control group. So we're in this big experiment, and the question in the press is, should the government mandate vaccine passports to participate in the regular events of life? If it's an optional experimental thing going on, I would say no, because it makes sense.
Well, as an attorney, Jim, what do you say to the people? Because I hear this all the time, too. If you create a passport system, aren't you creating a two-tier system where one group is going to be treated better than another group? And is that not constitutional?
Well, we talked about that a week ago because we put the Tucker video on, and the guy that was Tucker's guest said something that I hadn't thought of at all, which was, so you have this mandatory vaccination thing for the passport, but everybody can't take advantage of it. He didn't say this next part, but I'm going to. People can't take advantage of getting a picture ID. That's why we can't have picture IDs in voting, right? Well, what part of the community do people think can't get a picture ID? That same community may be the community that can't come around to get the vaccine, and so they don't get the passport, so they don't get whatever the passport gets you into, which may be restaurants, may be theaters, may be sporting events. It may be limited to trains, planes, and automobiles, boats. But that's the two-tiered system.
Well, where does the argument that it's unconstitutional come in, though? Like, where in the Constitution does it say that the government cannot make you do a passport?
So it's interesting. Roe v. Wade told us in 1973 that it's our bodies.
It's the privacy argument.
The privacy argument. That's one of them. Another one is the Constitution does provide for the right to travel between states.
Okay, which you love this because this is the thing that will set you on edge all the time. We're in Hawaii. The only way people in Hawaii can travel is by plane or boat, period. I mean, you could try to drive from here to California, but it might be a little bad.
Well, and so the question becomes, if I have the constitutional right to travel from Hawaii to California and then drive if I want all the way to New York, Florida, or Maine, can I be prevented from the first leg of my interstate travel because I'm not allowed to get on an airplane or a boat because I didn't get the vaccine?
So now this would apply to Alaska as well as Hawaii.
You can drive from Alaska through Canada. That's not water.
That's true. So Hawaii really is.
It's only us.
It's only Hawaii.
And I suppose Puerto Rico and Guam, they're not states, but they're affiliated.
Well, again, we're talking about the Constitution. So where does the Constitution give us this right?
But then you've got to actually look at the cases that have examined the smallpox vaccine in 1905. Because the U.S. Supreme Court was asked in 1905 whether the smallpox disease vaccine could be mandated by the government. And they actually didn't want to answer that question. So what they did is what John Roberts parroted in the South Bay Evangelical Church case last year. The federal judges shouldn't get involved in the medical issues that local elected people are dealing with. That's what the Jacobson case said in 1905. But things have happened in constitutional law in this country since 1905. And one of them is this whole constitutional jurisprudence over the federal government and then the states are not allowed to interfere in fundamental rights unless they are seeking to accomplish what's called a compelling state interest. And if they jump that hurdle, then what they're actually doing has to be the least restrictive means that the government can come up with to accomplish that compelling state interest. And that gets really messy. What is the compelling state interest with vaccines for COVID being mandated for passports? The argument would be, well, obviously, the sickness. But is it more compelling for COVID than flu, pneumonia, who knows whatever, sicknesses the government never cared about? And you're going to have expert testimony by epidemiologists. And of course, Dr. Park, who was the state of Hawaii epidemiologist last year, testified in two of my cases in June and July, federal court and then state court, using March data. She told the judge it's highly contagious and highly likely to kill you, which by June and July, everybody knew was not true. So when the government's epidemiologist testifies like that, the judge goes with the testimony because she's highly credentialed. I mean, she can say medical stuff. She's got the credentials. And at the time we were dealing with very low COVID numbers here. And then, of course, you get into the whole argument about the PCR tests, positive results being skewed and all this other stuff. So that compelling state interest test is going to be a huge legal battle between the experts on both sides.
Well, and I think you just hit what a lot of the people that took our survey in their comments. Last week, we did talk about, the idea of forced vaccinations. And one of the things that kept coming up in the comments was that people are strongly opposed to passports. I mean, there was a couple smattering of people that thought it was a good idea for travel. But people time and time again in their comments brought up that this is a bad way to do business.
So the people that were responding to the survey were part of the faith group of citizens in Hawaii. Even the ACLU, who doesn't agree with me and I don't agree with them on most of the policy issues, they're opposed to mandatory passports. Their big problem with it is privacy.
So why does
Because it's medical information. Did you take a vaccine or not?
Well, yeah. And people don't want, can you imagine if the government started saying, we need to know that you've had your AIDS test?
Well, that's the first time that I became aware that the government wasn't going to do contact tracing on a contagious disease. They've always done that because that's how you stamp it out early. You find the people that get affected and you deal with it.
Well,
AIDS did not do that.
Yeah. But that is easy to go back to for those of us that remember when it really started to become an issue and people were really concerned. And you remember the fear back then, right? There was a lot of fear on how that could be transmitted and how you'd get it.
Which is why the press said everybody can get it.
And here's the thing at that time. If you got AIDS at that time, you did die. It was yes, serious. It was very, very serious. And our hearts go out to people that have had to deal with that. But I guess the question is, why are they talking about it then? Why do you have leaders talking about it if there is so much, like even the ACLU having, concerns about this? Why are they talking about it then?
So
how are they able to do that?
There was a group of industry leaders because the government is restricted by the Constitution, but private industry is not to the same level restricted by the Constitution. Statutorily, employers can be prohibited from discriminating. Public accommodations can be prohibited from discriminating, but it's on a much smaller list of characteristics. So this group of national airlines, hotel chains, I forget who they all were, big box stores, they wanted President Biden and they were pressuring the White House to be the source behind this vaccine passport because they want to be protected by it. It would make their operations easier.
Well, have you read? I don't recall any stories saying that there was any breakouts in any airport or
You know what?
airplane.
I flew on United Airlines at Christmas and to upstate New York, which is a very long flight from Honolulu. And I think it's a 3-movie flight, like a 3-hour cruise. And every hour they showed a 3-minute video about how impossible it is to get COVID on a United Airlines flight.
All right.
Based on all the stuff that they do.
Well, I'll tell you what, this conversation is far from being over. We're really going to get back into the discussion we were having on the survey. And we're going to be dealing with the question that graded the governor, the lieutenant governor, Department of Health leaders, business leaders, church leaders. And we're going to find out a little bit more about what you, the faith-based community in Hawaii, felt about that. We'll be right back.
We have a mission here at Kalo TV. We continue to be the only local Christ-centered media outlet in Hawaii. God has planted this station to nourish believers and to harvest souls for eternity. It's a calling we hold dear, and today we need your help. Partner with us as we continue to create original local programs.
We're so very grateful for that whole journey.
Walking down to our story room.
Oh my God.
So it's where the state cannot tell the church how to run their services, what songs to sing.
Showcase solid biblical teaching.
We reach more people in one day with the broadcast of the gospel.
It's music to God's ears.
Improve our infrastructure and influence social media. In these dark and disruptive times, there's never been a greater need to be rooted in God's Word. The Kalo plant has been a sustaining food in Hawaii for centuries, and Kalo TV aims to bring much-needed spiritual nutrition to these islands. Are you willing to labor with us for Hawaii, for your ohana, for the next generation? Go to kalotv.com and partner with us today.
Aloha, I'm Eva Andrade. I'm the president and CEO of Hawaii Family Forum. And Hawaii Family Forum has been serving the faith-based community right here in Hawaii since 1998. What we do is we identify like-minded people in the community, we educate them, we motivate them, and then we activate them, standing on the foundational principles of Micah 6:8, which says, "What does the Lord require of you but to love justice and to do mercy and to walk humbly with your God?" So join us at hawaiifamilyforum.org and let's make a difference right here in this beautiful state of Hawaii. Mahalo. Welcome back to Faith in Politics. And I know our viewers and listeners have really been waiting for the continuation of our discussion on the survey that Hawaii Family Forum did. And we are only going to be focusing on one question today because this one question has some subgroups. And so, Jim, you want to let everybody know what the question is that we're looking at?
I will. It's question number 3 on the survey. By the way, think about, but you may decide not to. Send out another survey letting them grade you and me. No, we don't want to do that.
Oh, yeah.
Okay, question 3. How well did these leaders handle the pandemic, in your opinion?
Okay, now before we jump into the answers, one of the comments we got was from an individual that felt that this was a leading question. So as an attorney, can you explain to me how this was a leading question? How well did these leaders handle the pandemic? And the choices that they picked for each one was...
Stop right there. The fact that there were choices means that it couldn't possibly have been a leading question.
Okay. Well, I want to give that person a voice. They had a voice, and so we gave them. So in each of these breakdowns, what they were able to do is pick one of 5 choices. The first one was, they need to go. I'm over it. The second choice was absolutely poor. The third choice was moderately well, but there was too much of a political spin to their position. They could pick the best they could under the circumstances, but there were some areas they could have done better. And of course, they were also able to say that they did very well. So the first group was...
Okay, so the question was, how well did Governor Ige handle the pandemic, in your opinion?
Now, this was easy because Governor Ige was the governor through the entire time of the pandemic.
Well, not only that, but he's the human being that declared the emergency and that issued 19 emergency orders. It's on him.
All right. So, and again, remembering that this group was the faith-based group representative. So the highest score he got was 161 people said he's got to go.
And by the highest score, what you mean is most of the people thought he needed to go.
Absolutely. And the next...
That's a low score. That's
well, yeah.
I mean, that's a very low score.
Yeah. So one of the comments that I got from somebody directly about the survey was they felt that this was a way to beat up on the leaders. And actually, that was not my intent in any way, shape, or form. And actually, by looking at the results, we can see that there were some people that strongly felt one way, but they also strongly felt another way.
Yeah, but I actually filed 2 lawsuits against Governor Ige about his use of these executive powers for COVID. So it's not the only way to beat up on him.
Okay. Well, 103 people felt that he did a poor job.
So that's actually 264 against.
Yes. And then, but now we're moving into that people felt he did a somewhat decent in different levels. 101 people felt that he did moderately well, but there was a political spin to his position. 60 people thought he did the best he could under the circumstances, but maybe there were some areas that he could have done better. And 7 people thought he did very well. So when you break this down, 168 people think he did a good job and 264 people think he did a bad job.
So next time we do this kind of a questionnaire, we should also have a question in there separate from question 3. It could be like question 7. Where do you primarily get your news? I would really like to know if the 7 people that said he did a good job get a certain news feed.
Oh, stop. And because, again, it was an anonymous survey, we have no idea.
We don't care who they are, but I'm just saying where they get their info.
All right. We got to get through a couple more groups here.
So the next one is how well did the lieutenant governor, that's Josh Green, he's been there the whole time, and he's also a medical doctor, emergency room doctor. How well did he handle the pandemic? And the people said.
Okay, so there was 113 people that felt he needs to go. 64 people thought that he did absolutely poor. 106 thought he did moderately well, but there was too much of a political spin to his position. He had 106 people thought that he did, moderately well. And then 97 people thought he did the best he could under the circumstances, but there was some things he could have done better.
And there's some truth to that, because if you remember the news, he was opposing Ige and Mayor Caldwell. They were kind of 2 separate camps on a lot of things.
I was going to say, 62 people thought he did very well. So when you break his up, 255 people thought he did a good job.
And remember at the beginning, he was the one saying, we've got to open the economy. Tourism has to come here.
I will say, and 177 thought he did bad, but he actually scored pretty well on the people that thought he did moderately well to good. And I will say that in the comments, several people thought that he should have taken the lead right from the very beginning, and that Governor Ige should have just let him do his thing because he was more moderate and he did a better job. There were some people that, had some issues, but I think for the most part, it seems like the lieutenant governor did a somewhat decent job.
So before we go to the next one, I just want to say, because I think it bears noting, and that is the legislature, according to the law that gave the governor the right to declare the emergency, they made that law, and that law said on the 60th day, the emergency power is supposed to go away. The emergency powers being that the governor became the legislature all by himself, and the legislature was supposed to come back in, which they never did. And what I'm thinking is politically, if you have to run for office again, you don't want to be responsible for COVID because it's a no-win. In your next election, you're going to get hammered with whatever you did to control the COVID thing. So I think the legislators said, we don't want us. Governor, it's on you because you're already 2-termed. You can't run for governor again. And it's just kind of interesting that he didn't let Green become the face of COVID, even though Green's a medical doctor. And it might be because he didn't like Green's position. He liked Caldwell's better.
Okay, well, as we move into the next group then, because it kind of ties in, why don't you give us the answers for the next group?
Okay, so the next group is actually 77 people.
Okay.
76 people.
The Hawaii State Legislature.
The House members and the senators, but it's like all of them. So it's kind of weird. Some are good, some are bad, some don't show up. But they all get the same grade.
Well, and on the comments, there were no specific comments other than that people didn't like that the legislature kind of did what you just said. They kind of tossed it to the governor.
So they need to go, I'm so over it, 158 people. That's almost as much as the governor. Absolutely poor, 111, more than the governor. Moderately well, but there was too much of a political spin, 119, more than the governor. The best they could under the circumstances, but there was some areas they could have done better. Only 40, which is way less than the governor. And very well, only 4 people. Who are these people? Less than the governor, 7.
And so breaking that up, 163 people felt that the Hawaii State Legislature did a good job, and 269 people felt that the legislature did a bad job. Now,
they actually did nothing.
Well, but okay. So,
which is a bad job.
So there is a bill right now that is moving in Hawaii State Legislature that will give them back the power they should have had to begin with on the governor's emergency orders.
That bill contains all the arguments I made to the judge in Kona as to why the other states in the country's emergency laws are different from ours, because what those other states do is what's in this bill. So our legislature, and I'm not saying it's because of my lawsuit, but it's exactly the same steps. Exactly the same steps.
And so we will see, if anything like this ever happens again, God forbid, that it will be the state legislature then that will have some oversight on what the governor does.
So here's why it matters. The governor is elected statewide. People that vote don't know the governor. They don't go to the governor's office. It's a big office statewide, lots of water in between all the islands. But your House member is in your
backyard.
Your valley. You know, I live in Ainahaina. So from Waialaiki to Kuli'o'o, we have House District 18. And we know Mark Hashem because that's 25,000 people that he represents. We can go to his office much easier pre-COVID.
You know we got to go through other groups, right?
I do.
Okay,
but the point is, the reason that you want the legislature in charge, legislating, and not one guy, the governor, is because they're more accessible.
Again, so we have to do our typical, that we always bring this up, people have to register and they need to vote. They got to vote.
So the mayor is our next
category
eligible bachelor.
Okay.
Go ahead.
Okay, so go ahead and give us give us the answer there, Jim.
Okay, so they need to go 131, absolutely poor 92, moderately well, but there was too much of a political spin in their position 106, the best they could under the circumstances, but there was some areas they could have done better 75, and the mayors, but it's not a mayor. It's
I was gonna say go ahead and give that.
Very well, 28 people. But which mayors are they talking about?
All right. So here's what's interesting. So when you break that down, 209 people thought that the mayor did a good job, and 223 thought he did a bad job. However, several comments were like, "This is for Mayor Caldwell and not for Blangiardi."
But even mayor isn't just Honolulu.
Well, and people made that clear as far as the Big Island, right? You had different mayors. So I really appreciated that people made it clear that there, and I had to go back and look because even though it's anonymous, and so I don't know who it is, I do get one printout for each anonymous so that I can see all of that person's things on one sheet.
Oh.
And I will tell you that for those people that made that comment, 98% of them were negative towards Caldwell.
Okay.
So they voted badly for the mayor. So, if Mayor Blangiardi and the new mayor of the Big Island is listening, this may not quite be for you, but it is lessons learned. And
let me just say that when I actually did my answers on the questionnaire, sorry, Mayor, I forgot about Blangiardi. I was only thinking Caldwell.
Well, yeah, and so we want to make that clear. And again, we're going to make all of these results public when we're done with
but
these
not the
next
people's
shows.
names.
We don't have that. But the comments, people will get to see the comments as well.
Some of them are fun.
Okay, as we move into, let's do one more.
Public health leaders.
Okay, so the public health leaders, and again, this one was tricky because we had several. So we had 137 people said they got to go. Well, they got their wish because we've had such a turnover. 105 people thought, what's the second one?
Absolutely poor.
Absolutely poor. And then we had 96 people.
Moderately well, but there was too much of a political spin to their position.
Okay. And then 74.
The best they could under the circumstances, but there was some areas they could have done better.
And 20 people thought they did very well.
So I want to tell a story, can I? Do we have time?
No, we don't. But okay.
Well, so in June or at the end of May last year, I called Dr. Park, who was the state's epidemiologist in the Department of Health, and left her a message because I saw her on a TV show. They were talking about COVID. She called me back like the Monday after the weekend thing. And so I was very graciously happy that she called me back. And so I asked her about why the health department doesn't publish the numbers broken down more, because every day there's or every week there's a COVID, how many people new sick, how many new in the hospital, how many new died, blah, blah, blah. And I asked her why they didn't break down the new positive test results into who had no symptoms, who had some symptoms, but they weren't sick, who had symptoms that were like the flu, they were out for a couple of days or a week, how many actually had to go to the doctor, how many, and her response to me was that it was too hard to collect that information. And I said, no, it's not. When you're asking the other questions, just add more questions. And I was shocked at her response. She said, well, now you're getting aggressive, and she hung up on me.
Okay. Well, when we come back, we're going to get into the last two groups, which is business leaders and churches. And you don't want to miss that. So on this episode of Faith in Politics, we'll be right back.
We have a mission here at Kalo TV. We continue to be the only local Christ-centered media outlet in Hawaii. God has planted this station to nourish believers and to harvest souls for eternity. It's a calling we hold dear, and today we need your help. Partner with us as we continue to create original local programs.
We're so very grateful for that whole journey.
Walking down to our story room.
Oh my God.
So it's where the state cannot tell the church how to run their services, what songs to sing.
Showcase solid biblical teaching.
We reach more people in one day with the broadcast of the gospel.
It's music to God's ears.
Improve our infrastructure and influence social media. In these dark and disruptive times, there's never been a greater need to be rooted in God's Word. The kalo plant has been a sustaining food in Hawaii for centuries, and Kalo TV aims to bring much needed spiritual nutrition to these islands. Are you willing to labor with us for Hawaii, for your ohana, for the next generation? Go to kalotv.com and partner with us today.
Welcome back to Faith in Politics. We are going to now dig into the last two groups, which are business leaders and churches. So, Jim,
who, of course, had very little control over anything.
Yes, but it is interesting. So on the business leaders, Jim, how did they do?
So you want to read the description of the answer and I'll give the number?
Yes.
Is that what we're doing? Okay.
Yeah,
so
that would be good.
For business leaders, the first number is 58, which represents...
They need to go. I'm so over it.
So that is so odd. You can't fire business leaders.
Well, but maybe they think they need to close. I don't know.
Okay. The next one is Holy smokes. Blue is a bad background. 69.
Okay, and that's absolutely poor.
Okay, that's fair. 131.
Moderately well, but there was too much of a political spin to their position.
156.
The best they could do under the circumstances, but there were some things they could have done better.
This is really weird because business leaders, there's 18 people that liked them. We don't even have Chick-fil-A here. Who could it have been?
I don't know. And that the last one was 18 it very well.
Yeah.
But what's interesting though is so they had the business leaders, 305 people thought they did good and 127 thought that they did bad. So actually the business leaders did very well. Whatever that means, there were a lot of comments addressed to things like the airlines and the Department of Health. I know they're not really business leaders.
No, that's government.
I mean, not Department of Health. I'm sorry, the Board of Education, which is also government. But I mean, the specific directed at different agencies seemed to be the Board of Education in what they did in shutting down the schools, which also affects the decision of the government officials. Business leaders, people talked about the airlines and the possible passports. The businesses that might be talking about, in order to eat in our establishment, you need to have this passport. So people are very concerned about that, and they didn't hesitate.
So the interesting thing is, on most of last year, 2020, every Saturday there was a protest at the state capitol, and I went to most of them because I'm a protest kind of guy. And the beginning, it was about opening the economy, and the people, it was actually like a protest with signs, political signs, and that kind of stuff. And the focus of the messaging probably way through the summer. My birthday's in October. I think it even went beyond my birthday, was opening the economy. It wasn't medical issues. It was business issues. And there were people, because you've got 300 or 400 people hanging around the Capitol grounds and you're chatting while you're sign waving and everything. There were business owners, like there's this one guy whose name I don't remember, but he owns a whole bunch of Irish pubs in Hawaii. He had to shut them down. He went broke.
There was a comment from an individual who actually said that I had to shut my business.
That might have been who it was. I don't know.
Yeah.
But and the question with hindsight now, because remember in January, February, March, April, when we were doing the shutdown, it was supposed to end at Easter, but it went on. Everybody thought everybody's going to get this disease and everybody's going to die from it. And it was pretty scary and emergency and all these heavy-handed requirements, but they stuck along way longer than they needed to, especially because we didn't have very much COVID here. If you look at Governor Ige's first series of emergency orders, he said, we don't have any COVID here yet, but because it's in other places, I'm going to do this stuff.
Yeah, and
people were very angry.
I will tell you that, again, what came through a lot in the comments is people are very concerned about the local businesses that suffered greatly during this.
And it was the mom and pops.
And it was the mom and pop stores that have been open. I mean, Love's Bakery. I mean, there are things that have been a part of Hawaii's history that are now gone. Yep. And I think that these things can never be replaced. They can never come back. This is part of Hawaii's history, and I think that bothered a lot of people, and that kept coming up. So
but the business leaders did way better than the government.
They did, and so basically they got good. So the last group, we're just going to give you the numbers, listeners and viewers, but we're going to get more into detail next week on this, and that is church leaders. We asked how people rated their church leaders. So
you want me just to read the numbers, and we won't do the info. So the numbers are, this is like bingo, 19. 68,
so this is going again
74,
bad to good.
188 and 83.
Okay.
Bingo.
So basically, 345 people thought the churches did good. And 87 did bad. So the church actually did far better than any of the other groups. And on the bad comments, which we're going to get more into detail next week, was basically that the church caved. I mean, seriously, just kind of writing them all in is that people felt like the church should have never caved. Every church leader should have said, we're not closing, we're essential. I know that.
I tried very hard to get clients, church pastors, to let me represent them for free, and I couldn't.
Yes, and actually there were a couple of comments about King's Cathedral on Maui and the attention that they've gotten. So, it is something that is on the minds of people. And so we're going to get more into detail. And next week, what we're also going to do is share a little bit more of the comments that people have put in, because we didn't do as much today as we did. And again, we're going to make all of this available after next week's show. So what I want to do for you, dear listener and viewer, is just remind you that in order for this program to continue, we need you to partner with us. And you can do that by calling Kalo TV, the number that's on the screen. You can email them or visit them on the website.
And please do.
And please do, because, the more people that join and partner to make this show happen, the more we'll get out there. And if you think that what we do is worth it, then we need you to come alongside us and make that happen. And for K-Light Radio, who continues every week to put out great shows and a great message to a dark and dying world, you want to partner and promote these great.
And I'm very glad to be back at K-Light.
Yes, in this beautiful studio. And so, as always, we want to thank Kalo TV for their continued partnership with us. We want to thank K-Light Radio for always providing this great studio for us to come and do this. But we also want to thank you, the viewer, because Jim and I are getting inundated by you who are reaching out to us to just tell us that you appreciate what we do. And I love it that some of you are saying, well, we don't agree with everything that you guys say, but we appreciate that you're giving a voice to the faith-based community, and we want to do that. We want to continue to do that. Write a check. Even if it's just a one-time donation, Kalo would really love to continue their ministry of bringing good news to Hawaii.
Amen.
And they have a Kalo outreach. So for those of you that want to donate money because you want to actually put some money into hands work, then again, call Kalo TV at the number on the bottom of the screen. Reach out to them on their email or website and find out how you can partner. Send me an email at eva@kalotv.com and let me know what you, the viewer or listener, wants us to talk about. And we will try to incorporate that.
So send me an email at eva@kalo.com.
Okay, yes. And next week, you want to join us because we are going to be only talking about the rating that the church and pastors got during the lockdown. So for those people that felt we were picking on just government leaders, you want to stay tuned.
Absolutely.
Because you're going to find out some very interesting comments that were made about the church and church leaders. So make sure you join us next week. As always, 10 a.m. on Friday, Kalo TV, or on YouTube, Kalo TV, Faith and Politics. And K-Light Radio, always listening, 10 a.m. We'll see you next week.
Aloha.
Mahalo, everybody.